Welcome back to Cityline. With me, I have Racheal Lynch. She is the Director of Donor Recruitment for Cascade Regional Blood Services. Hello, Racheal.
Hi.
It's good to have you here today. So let's get right to it. Governor Inslee recognized December 18th as Blood Donor Day in Washington State to commemorate the Amtrak train derailment and bring awareness for the need for blood. For people who perhaps don't understand or don't see that connection, can you explain to us why donating blood is so important?
Sure. Yeah, an emergency or a trauma can happen at any time. And so it's so important for us to keep a healthy blood supply, especially when, surgeries and transfusions happen on a regular basis. So, when extra blood is needed, that supply can run short. So it's important that we maintain that healthy supply at all times. And so it's important for us to have blood donors consistently all the time.
So the Amtrak train derailment in 2017, as I said, it demonstrated that when it comes to emergency needs, our blood supply needs to be stocked and at ready outside of just a daily level that we like to have those blood supplies at. Where is our blood supply now as we speak, Racheal?
Yeah, so in November, we started testing all of our blood donors for antibodies, and that actually helped us increase our blood supply, which has been fantastic. We saw a lot more blood donors coming in because they wanted to be tested for COVID antibodies, and which has been fantastic. We've saw an influx in donors, and we really appreciate that. But typically this time of year, we actually see less donors, and so it kind of drops off because people are busy during the holidays, and we really need people to continue to come in and continue to donate because we need to keep that supply steady. The hospitals are still doing, routine surgeries and elective surgeries during this time, and it's very important that we keep that, blood supply regular, routine and keep that supply healthy. We are going to continue that antibody testing through the end of January so that we can keep the supply healthy on our shelves. Over the past couple of months, the U.S. has actually saw a critical supply shortage. This past month, we've actually been able to increase our supply because of the antibody testing, but that's not to say that it's going to stay that way. So we need the donors to continue to come in and continue to donate so that we can keep our supply here at Cascade Regional Blood Services, healthy and keep our shelves stocked.
So well said, Racheal. So Racheal, is the blood that is donated 2 weeks prior to an emergency the one that's used for?
Yeah, we typically send out our blood to the hospital, the blood that we receive to the hospitals right away.
So is donating blood safe?
Absolutely. According to the FDA and the Surgeon General, it's safe to donate blood. Donating blood is easy, and it only takes about an hour of your time.
So is it still safe, even during this time, to donate if you have had COVID-19?
Yeah, it is safe to donate if you've had COVID-19, as long as you've been free of symptoms for at least 2 weeks. In fact, we are collecting CCP, which is COVID convalescent plasma, for patients who are suffering from COVID right now in the hospitals. If someone is sick with COVID and if they were sick with COVID and they've had a positive COVID test, they may be eligible to donate CCP, which is COVID convalescent plasma. And it's a great way to help people who are fighting the virus, and it's a great way to help our community.
So, Racheal, I think a lot of people, when we think about donating blood, especially during this time, we think, oh, can the coronavirus be transferred through a blood transfusion?
Yeah, that's scary, right? It's a scary thing to think of, but there have been no known transmissions of COVID through. There's been no known transmissions of COVID-19 through blood transfusions.
So what precautions are you taking to keep donors and patients and that wonderful team of yours safe?
Yeah, we're taking many precautions for our donors, patients, and staff. All our staff are screened each day as they enter our centers. Their temperatures are checked. We're doing screenings for symptoms. All of our donors are checked upon entering our centers and our mobiles. They're checked for their temperatures and symptoms as well. And then when our nurses go to the hospitals, they check patients for all symptoms and temperatures as well.
So I hope that everybody who's listening to this right now decides that they need to go donate blood. So Racheal, talk us through the process of how we go about doing this from start to finish.
Yeah, we definitely need more people to donate. It's so important for new people to donate and for people who've donated before to continue to donate. And there's two ways that people can do that. They can either call and make an appointment with one of our schedulers, and they can call the phone number. The main line is 253-383-2553. Or they can visit our website, which is crbs.net, and they can view all of the locations where they can donate, either at our centers or one of our mobiles. And there's lots of different ways to donate, different places to donate, and we'd love to have them come in and do so.
And so once they get there, walk us through what happens.
Sure. So the first thing someone will do, whether it is at a mobile location or one of our centers, is check in. They will fill out all of their information with a receptionist or on a mobile in a little room. And then they will go through health history, where they'll answer, just health history questions, if they've done any traveling, medications that they're taking, just their general health history. Then they will go sit on a bed and, get their little prick, and then they'll donate. The actual donation process typically takes less than 15 minutes. Once they're done with the donation process, they will go to what we call the canteen, and they get their cookie, their snacks, their drink, and then they're all done. Typically, the entire process takes less than an hour.
My last question for you, my dear, is how often can we donate blood?
Yeah, you can donate whole blood every 56 days. You can donate platelets every 14 days, up to 24 times a year. And you can donate plasma every 28 days, up to 13 times a year. And you can donate CCP, which is so important right now for the people who are fighting COVID in our hospitals, every 7 days, up to 4 times. And we definitely need more people to be willing and able to donate that CCP.
Racheal, I want to say thank you so much for your time today and for all of the amazing information that you gave us.
Yes, thank you so much. Thank you for having me.
It's been our pleasure. We have much more to come on Cityline, so don't go away. We'll be right back.